How many of you are 53 years or older? Did you put your hand up? 53 years or older, okay? So look, one more time, put the hand way up. So look how many people there are, right? So if you were homeless, 50% chance you'd be dead now. 50% chance. Average lifespan in Hawaii and across the nation is 53 years. That's the median age of lifespan. So God help us if we were 53 years. That's the median. How many of you spent $82,000 a year on your health care last year? Almost nobody, maybe nobody. That's the median spend of a person who's a high utilizer who's homeless in the state of Hawaii per year, $82,000. So in time throughout this conversation, I'm going to describe how health care and housing come together and why, in my opinion, homelessness is a medical condition. I'm going to unpack that, but keep those two visuals in your mind about how impactful it would be to all of us in our state and our country, what the mortality rate would be if we were homeless, and also the cost to our healthcare system. Now for a second, before I dive in, imagine there's an epidemic in America, or in any industrialized nation for a second. Imagine that it decreased, this disease could hit any age, whether you were 3 years old or 1 year old or 60, any age. It decreased your average lifespan by 24 years. Terrible disease. Imagine also there was a treatment with no side effects. Wasn't cheap, but truth be told, maybe it might cost $14,000 to $18,000 a year to treat it. Might go on for a couple years that you needed that treatment, but like I said, no side effects. And the good news is, if you receive that treatment, that expensive treatment, your overall cost of healthcare, all the rest of your healthcare, drop between 43 and 73%. How many of you would want that treatment if you had that disease? You're going to not die 24 years earlier. That's homelessness. It has no side effects to treat it, and it can be cured if we look at it through the healthcare lens. So again, I want people to begin to envision this crisis in a different way, this epidemic of homelessness. Now, on the first slide you see here, this is me, and it's what we do to people. We put lays on them when they win an election. That's my daughter standing next to me. And it's an honor to serve because it gives me an opportunity to be in this room with you to talk about what I believe is our next healthcare crisis in America, and it's really taken over right now. So I work as a physician still on the weekends in the ER. My road's been weird. I decided I wanted to be a doctor in India many years ago, volunteered in Swaziland in rural hospitals where the HIV rate was 56%, saw healthcare from that perspective, and joined the National Health Corps. And much to my sadness, I was sent to Hawaii to practice in the National Health Corps. So I worked in Ka'u for several years, and I was complaining a lot because people didn't have access to trauma services or drug treatment or social services, all of which are healthcare in our traditional sense. So I kind of shut my mouth off and I said I'd like to do something more. I'd like to probably try to solve these problems. So I ran for office, and in going door to door in my scrubs, I found some people liked me, most didn't, because it's a new guy, and what's he doing running for office, going door to door. But fortunately, my opponent was a cocaine dealer, and I won that first election. So after winning that highly contested race in 2004, I stayed in office, as most insiders do, for a long time, and got lucky to get married to a great person and have some babies, not necessarily in that order, and proceeded to serve for the better part of 15 years in the legislature, and then became lieutenant governor because a lot of people just wanted a bigger picture to be addressed. And I began to see things through a human service lens and a healthcare lens that I think can apply to the greater society. And that brings me to today, where I'm talking to you guys. So weird roads bring us together, but this is what I want to talk about today. Homelessness in Hawaii, which is homelessness in America. The ecosystem of a crisis that is pummeling small states, big states, California, Washington. I know in Seattle it's an enormous challenge. In Hawaii, we have the highest per capita rate of homelessness in the nation. This gentleman is on my slide because it says quite a lot. This is his home, this canopy. He's African American. He's a minority, even in a state with very few minorities, because we have great ethnic diversity. He lives on nothing. He's likely to be one of the individuals that will die by the age of 53, if not shortly thereafter. In the background, just 2 miles down the beach, are condominiums that cost $2 million to buy, or rent at $10,000 a month. He lives in extreme abject poverty and suffers so many health conditions they can't even be described. Yet he's right next to some of the wealthiest, most beautiful parts of the world, and it becomes a moral problem for us, and it becomes a challenge for the system, the healthcare system, and all of us everywhere. I said already that we have a high homeless rate. It turns out that just last week they believe that New York has surpassed Hawaii with the highest per capita homeless rate. But we are right there at the top. And why? Well, of course, it's easy to live in beautiful Hawaii. If you transplant there, you won't die of weather exposure. And it's very expensive to live there, so people fall into poverty. But we have so many individuals that are chronically homeless, meaning for more than 6 months, who have mental illness and addiction, who has that great challenge of life expectancy of only the low 50s. And most are unsheltered that are suffering these conditions. And those very individuals are the ones that I described to you that have a very high cost to society economically. I mentioned the high rates of mental illness and addiction. Some people use numbers in the low 10s, 20 percentiles. It's much higher than that. I will share a slide with some of the traditional numbers, but keep in mind, if you're on the street for 6 months, you will be suffering PTSD. You will. And all of the sequelae that come from that. If you're under age 40 and you're on the streets and you're a woman, you will be raped. If you're a gentleman and you have any conflict with someone who's dealing drugs, you will be beaten into a place where you have to go to the hospital. These challenges create an incredible impact on a society and a healthcare system, but worst of all, the individuals that are themselves homeless. And this is what it looks like for those of you who are large policy wonks, who look at your budgets every day, who have to deal with the Medicaid budget. Some of you are directors or presidents of plans, or certainly in the healthcare system delivering care. In our small state, 3.6% of our Medicaid population, just a tiny percent, consumes 61% of our Medicaid budget. We're a small state, so our budget's $2 billion. That means that 13,000 people, we're a big Medicaid expansion state, consumed $1.2 billion. And that's $82,000 per person per year. And how does that happen? It's hard to spend $82,000 in healthcare. Maybe if you've got cancer or in a terrible car accident. But if you have to go to the emergency department every day, if you're injured, if you're afraid, an ambulance costs $1,250. Someone sees me in the ER at $1,600. Another $2,000 to stay over if you need antibiotics or IV fluids. So you can imagine these encounters drive up costs incredibly, and we don't do much more than put a Band-Aid on someone. We don't change the trajectory of the crisis. There, we're just sitting on the street providing wound care, terrible wound infections, staph infections, which land people in the hospital and cause other epidemics. So by the numbers in Hawaii alone, we could save over $300 million a year just by changing the way we view homelessness, by looking at it as a medical condition, as a medical problem. Many of you are sitting there saying, well, okay, it's a social determinant of health. Fair enough. It can be described that way. But why wouldn't we describe it as a health condition? It's not meant to judge. It's meant to say, I can treat a problem that is decreasing someone's life by more than 2 decades. I can get a result which saves money across the system. How familiar is that to all of you who are working on all of the many plans, whether it's accountable care organizations, capitated systems, patient-centered medical home? That's what it's about. But you can't do any of those things if an individual is homeless, or a small percentage of your people consume a large percentage of your budget. The moment we put a roof over a gentleman's head, this guy's in Waimanalo, these are tents that line the parks and streets, which you'll see if you visit Hawaii. This gentleman's healthcare costs drop by a minimum of 43% the moment he gets a shelter, the moment he gets a home. They thought I was making this up, so they repeated the study in Hawaii, Department of Health. It turns out it decreased costs 73%, actually. And when they did the same work here in Seattle, the expectation was it decreased costs 51%. So we know you see giant decreases in costs the moment people get shelter above them. We started what's called a joint outreach center in Chinatown, where people can just come and stay, get basic care, mental health care usually, wound care. In the first week, we started saving over $100,000 a week when people would just come there instead of go to our emergency department. So we started 2 of them. And we're now about to start a much larger facility, which I'll tell you about now. We raised money immediately because we realized we had some clue. We came and studied Seattle, we studied Portland and New York, we went to Texas, went all across the country to find out what's the best possible practice to look at homelessness as a health condition. And we found the following. No one was getting treatment for addiction who was homeless, nobody. It's hard enough to get people treatment for addiction if they're in a good middle-class life, in a job, to admit that crisis in their life, to find behavioral health specialists, to have enough resources. There was rampant drug use among people who were pregnant and alcohol abuse. Everyone was smoking, and it was generational now. There was homelessness across many generations. And then the opioid epidemic hit. And you all know what that does to a state. And on top of that, we have methamphetamine. So as homelessness and substance abuse overlapped, we looked at it in this very simplistic way. Poverty in the top circle, where poverty and homeless crossed over with addiction. And when you see that over there on the one side where addiction and homelessness was going on, very hard to treat, but people had some hope. If you added schizophrenia or bipolar disease or major depressive syndrome or PTSD to those addiction problems and poverty, you ended up in ground zero. And that's the chronically homeless population that I'm referring to. Those are the individuals that must be housed, and the moment that you house somebody, not only do you change their life for the better, you change the trajectory of the health economy in your state, and in my opinion, the nation. Now, this is the Gary challenge that we had. I don't know if I've spoken about Gary to Seattle before. A very wonderful guy. Gary told me to share his story. In 2017, Gary went to the hospital 241 times. 241 times. His Medicaid spend was $1.229 million personally. Gary passed away in early 2018 of a stroke and then sepsis in the hospital. Gary didn't have many medical issues, believe it or not. He was lonely. He had some mental health issues. He fell in love with someone at the hospital, which is not uncommon for someone to find comfort in an acute care setting where they feel comfortable and safer. So he went to the hospital every day. And he would have gone more. We would have counted him more, except many times it was overnight. We only counted him once in the hospital. The Gary challenge is what we face. If we can deal with a challenge like Gary and get him health care, and most importantly, get him shelter, get him housing, his costs drop like this. Nationwide, there are Garys everywhere, and not all of our 564,000 individuals are as that challenged. Many are children, 25%. 15% are chronically homeless like Gary. 46% have chronic illness. And then the overlap of mental illness and addiction is profound. But this nationwide problem will bury us. It buries us from a moral standpoint because it shouldn't be in a wealthy nation, but also from a health economic standpoint. The implications of people dying young, or at a 30% rate, 30% of all of our emergency room visits are individuals like Gary now. It's not a sustainable system whatsoever. And there are the nationwide numbers. 35,000 to 150,000 per person. That's the annual cost. That's 2 standard deviations out. 30%, like I said, are homeless population in the ER, which makes a big difference in your ER. And nationwide, the numbers are a little closer to 5% of those who are chronically homeless consuming half of our Medicaid spending. But they go to the ER 10 times as often. They don't get better. And these are some pictures of Hawaii. Very, very beautiful people, but that's how people are living in an industrialized nation in what some will say is one of the most beautiful places in the world. So this is what we decided to do, among many things. This is called the H4. We realized that we could prevent all those ER visits greatly if we gave someone a place to go and get basic care. A lot of this you've already heard because different parts of the country are doing different pieces of this. But if they're not all included, I will suggest it won't work. The hygiene center that we started had 90,000 visits in 1 year. Not unique individuals, but 90,000 visits to avoid going to urgent care and the ER. And then this March, we're going to open the 3rd and 4th floors, the medical respite. We call it H4 because it's hygiene, 24/7 healthcare is our 2nd floor, medical respite, 3rd floor, permanent housing on the 4th floor. It can be deconstructed, it doesn't have to look like a 4-story building, although ours happens to be. Funded by many of people like you in your disciplines. The plan stepped up immediately. HMSA, which is Blue Cross Blue Shield in our state, gave us $8 million to launch this. They said if people can go there and get care at a great fraction, a tiny fraction of the cost, why not? We're paying the bill anyway. And we've seen incredible successes already start. This is a better depiction of our Joint Outreach Center, where clinics can provide medical services. It decreases the strain immediately on our ERs. It's a place where there's no wait. We saw that savings immediately to the Medicaid plan. Sometimes I'll go there and do a small surgery for nothing, as opposed to $15,000 in a surgical unit. We collaborated with law enforcement. The police bring people there, and primarily we do wound care and mental health care. It's not perfect. We welcome everybody to come and partner with us, from the police to social work to everyone. And then we provide addiction services because we have a hub where people can go. And when we open the H4, we'll have a 24/7 psychologist and psychiatrist team, including telehealth, including outreach, including primary care, to offer that rehab that nobody could get on my island when I was serving in the Health Corps. And of course, we'll do all the social work we can to place people in permanent housing. We've proposed and now passed laws on assisted community treatment, and this is more controversial. This is for individuals with severe persistent mental illness, the sickest of the sick who are on the highway, on the road, who are out there and they have no clue any longer where they are or what they're doing in life. This woman, LaTanya, had a full thickness wound that I could see through her pant leg. I could see her femur through her pant leg, and she didn't want to move. And she's schizophrenic, and she'd been sitting there for 5 months, and we could do nothing until we passed this law. Now we can compel her to go get medical care, and we'll take her back there if that's what she wants, but after getting her care so that she doesn't die, number one. 2, possibly spend $1 million in a year. 3, create a public health problem as she spreads infection. And 4, suffer terribly. So we have 240 additional mental health beds that we need, and we're putting online to help people exactly like LaTanya. The Kauhale Initiative, a Hawaiian word for village, community. Please remember that. If you do this in your states, and I think they're going to be announcing this across the country in the coming months, if you do tiny housing villages, do a couple things. Make sure it is community-driven. It has got to be a community of people who are homeless, putting together their own rules, adhering to the laws of your state, but that community element is what makes it work. And when they did this in Austin, Texas, this is the definition of a Kauhale, a social respite center. We're going to do 12 communities across the islands. We should do thousands of these communities across America and not have any tents anywhere. You'll ask yourselves, how do we compel people? These are great challenges. But we will compel people by telling them we are going to respect them and give them a place to live, instead of a life in the hospital, on the street, in the weather, victims of domestic violence, victims of sexual assault. We build these very low costs, about $18,000 per tiny house. You give people an opportunity to pay a small amount of rent, and if they can't, you give them work. But everyone has a sense of self when they do this. And what's the benefit? When you have communities like this, they've studied them all across the country, 60% decrease in alcohol consumption, 70% decrease in drug addiction and overdose immediately. Violence plummets in communities, costs through the floor, and people actually have a home. A tiny home, of course, but a home nonetheless. And this is the successful story. I really recommend, if you have a little time, either get over to Austin, Texas, or just look up what they do. They put together what's called Community First. They created this community, first from philanthropy. They made it so that it was just like a little town, where people had some work. If they had addiction, they got treatment. They only got kicked out if they were committing violence or they were openly addicted and selling drugs. And they saw all of those results. And this, friends, is a solution to our healthcare crisis that we call homelessness. Other things that we do as Lieutenant Governor, as I wrap up, we bring people together. And I learned it from the Lieutenant Governor and the leadership in Utah. They said that's what they use their office for. But you can embed some humanitarian services in different offices in your state. But this particular solution is one that brings Republicans and Democrats together. I often tell the story that I thought was most extreme and in some ways the funniest ever. I was on Fox News one time getting pummeled pretty good by the Fox newscasters, and I explained what it meant to call homelessness a medical condition. And I explained that when you put a roof over someone's head, like I said earlier, drops their cost by at least 43%. Rush Limbaugh called in to say he supported this plan, because if any stupid liberal program can save money on entitlement, he's for it. And then the ACLU called in and said, not unlike my left-wing mom, housing's a human right. And if you can bring Rush Limbaugh and my mother together, I'm assuming we can bring the political parties together. Last couple moments, just wanted to share this. DJ thought I should. I wanted to thank many of you, people like you, who stepped up for, in many ways, crises all across the globe. Please keep doing that. There was a measles epidemic I think you might have heard about in Samoa. The Samoan government contacted us, and we sent 76 people over with 24 hours notice, and we immunized 33,997 people in 48 hours. Thank you. And in looking at this picture of this boy, this is the one boy I pray I get to see again. He was so beautiful. He was in about the 3rd day of measles, we knew it. And very likely he'll live. 82 people died, but only a trickle of people are still going to the hospital now. So it shows that public health missions can occur, and they occur, in this case, because of humanitarian generosity. We didn't spend any state dollars. But keep doing these kind of things for your state and your country, because I think we are honor-bound. We in this room who have had the luck to succeed and the will to succeed and to work hard and to make some money and do well in our station in life, for now anyway, we may very well be the drivers to deal with crises across the country. And I think homelessness is one of them. Others may occur in my state or abroad, but I just wanted to say thank you guys for doing what you do. You'll hear about the telescope on the mountain. That's a big issue in Hawaii too. It's another public health question in my mind, but it's also a question of human rights, indigenous rights. So come to Hawaii if you'd like. We welcome you with open arms. It is a special place. But come and look at homelessness. Look through the healthcare lens that I've proposed. Look through the lens of a multicultural place and incredible ethnicities, and just come and love Hawaii as much as I do. Thank you very much. These are some of the faces of homelessness in our state. Some who are doing better, some who still need a little bit of help. If you can be in touch, I'd be honored. It's really great to connect with you people here with great ideas, great capacity. It would be a great honor if we could communicate and collaborate going forward. But thanks again for having me. Aloha.
Thank you. It's great stuff, man. We just have a few minutes, but I think I can volunteer you for this, because I think you're gracious enough to do it. If folks from this community want to go to Hawaii, this time of year, we could all use a reason to go to Hawaii, and they specifically want to tour some of the work, the H4 location, or maybe talk to some other folks, can we connect them who might be interested with you so that you can show them around?
Absolutely. I have an extra bedroom. It's mostly pink from my 12-year-old daughter. We welcome you into our home, but our home state, of course. Yeah, if you would, please do text me or call me. Come to Hawaii. If you have capacity, if you have health interest, we'll take you to show you the H4. We'll show you what our joint outreach centers look like. You don't have to go very far into Heroin Alley, which is in Chinatown, to see the individuals that I'm on a hugging relationship with now for the most part, after spending lots of time in the streets with individuals who are struggling. But you can see it up close, and you can see how it both impacts Seattle, and it will impact our whole country if we don't have a solution. It is a great place and a particularly good excuse to come to Hawaii and to study healthcare and human issues.
So it's common for statewide elected officials, governors, lieutenant governors, to travel with security details. If you and I stand shoulder to shoulder, we're about half of the size of the two brawny gentlemen that have accompanied you here.
There's Lou and Fatu. Put your hands up.
Yeah,
you guys are awesome.
Particularly tough back there. Not somebody you want to meet on the rugby field. One gentleman talked to me about that Samoa trip and talked about seeing the experience of watching little babies pass away from measles. Can you talk to us about what that experience was like? I mean, we talk about vaccinations as sort of like an academic thing in policy settings sometimes.
Yeah.
But when you see whole communities with the red, sash outside their door to say, hey, we need a vaccination and we need people to come and help us. What is that like at a human level?
Well, it was extraordinary. the way the Samoan mission broke out, and I use mission softly because I'm not a missionary, I'm an agnostic Jew married to a Mormon, so, for perspective, right? We got to Samoa, and we landed at 7:30 in the morning. We flew all night, and we went right into the villages. So we didn't have any time to breathe. And beautiful people, welcoming people. Not a single person asked us not to immunize them. It was a fascinating experience in addition to a heartfelt experience. We went into one town, our village, where as we pulled in, one of the wealthier gentlemen of the village, kind of the father figure, said, there's a child. And he meant over in one of the fales, or small houses, right next to his. So we went there, and actually the pediatrician for my children, named Nadine, came with us. So I had a pediatrician with extra expertise. And she went and examined the child immediately. And she waved me over as an emergency doc and said, we have to intervene immediately, I don't know yet. And as she was saying that, she realized that this child, who had a very high fever, had actually died minutes before, but the fever was so extreme that this little girl still had, the essence of her in there, and still had the heat coming off of her body from a fever of probably what was 104, 105 degrees. We then proceeded to do a ceremony where we gave a small amount of money, which is what you do, which is, of course, a larger amount of money to individuals living that far into the village. And then we immunized the other 7 individuals in the family, the other 7 siblings. And it was just an incredible moment, because you realize that most of us as nurses or docs, physician assistants or nurse practitioners, aides, we may never see a case of measles, or very few. We certainly will never see a small hospital that's a critical access hospital with 4 beds, usually very basic stuff, overwhelmed by 27 kids that are on or near ventilation support, as though it was the ICU over at UW. It was incredible. So we saw that case over and over again. Almost all of the fatalities occurred in children under age 4. The magic of that trip was that we melded perfectly with the Samoan community and with the Australians and the New Zealanders and the Israelis and the Norwegians who came with smaller teams, and everyone just went to work for just a short period of time, because there could have been mass death there and then mass spread to California, Hawaii. I know in rural parts of Washington State there are lower immunization rates. And you know what it would do to our communities if we had 5 or 10 fatalities, and you know what it would do to our hospitals if we suddenly had 60 additional patients with measles that had to be treated on a ventilator. So these are global issues, and I will say this, the human stuff is what breaks your heart, but when you look at it from a 30,000-foot level, I guess as Lieutenant Governor, I honestly think that infectious disease and epidemics are going to have a much larger impact on the world than terrorism or differences of ideology going forward. So we as healthcare providers will be at the tip of the spear on these things.
Lieutenant Governor of Hawaii, Josh Green, thank you, sir, for being here. I appreciate it. Thanks, buddy. Yeah, great stuff. Good stuff.